Hello, my name is Amir Ron MD. I'm an orthopedic hand surgeon at Kaplan Medical Center in Israel. Today we'll be talking about tennis elbow. And before we talk about that, I would like to put in a disclaimer. So, this is not medical advice that you should be using. This is just for general knowledge. And if you need medical advice or need medical attention, please contact your local caregiver, whoever they be. So, we'll talk about tennis elbow. Tennis elbow is usually pain over here in the lateral aspect of your elbow. It is also called lateral epicondylitis. Epicondyle is the area right here, and itis is the ending signifying inflammation. So at the end of the day, what happens is we have the extensors here, and whenever you work your extensors, whether you be playing tennis, but usually because you are doing many tasks which might be forceful tasks, repetitive tasks, this will all cause tennis elbow. If you have local pain over epicondyle, when you press down, this might say that you have lateral epicondylitis or tennis elbow. Whenever you want to assess yourself, you can put your hand flat down on a table and extend your wrist with resistance. If you have pain when resistance is actually put here over your hand, you will have pain in this lateral epicondyle area. This will show that you have tennis elbow. In actuality, what happens is there is local inflammation here, micro tears, and these micro tears are not able to heal, and hence we have inflammation and angiofibromatotic changes in the tissues themselves underneath the extensor carpi radialis brevis tendon. This causes a local pain that you feel. This might be treated conservatively as a first line of treatment, be it physiotherapy, be it using an EpiPoint or other type of snug thing that will actually cover and prevent pressure from coming back to your elbow. You can also use a wristband in some cases, and in other cases, your doctor might suggest giving you an injection in this area, which could be an injection which contains steroids or some kind of blood derivative that he uses. In general, the steroids actually, what they cause is they will make your tendon slightly weaker, whereas usually the blood derivatives will make the tendon stronger. And this is actually what you might want in some cases, especially if you're a sports person. On top of this, I will say the following. When these non-surgical interventions fail, we will opt for surgery. Opting for surgery in your lateral epicondyle means that you will be getting a surgery here which is called a inertial procedure, which is usually the inflammatory area will be taken out of the area under the ECRB next to the lateral epicondyle. And in some cases, as I usually use, I will use a Wolf procedure, which will actually be adding another small tenotomy, a little bit more distally, adding to the efficacy of this surgery, in my eyes, and as we have already published. So, at the end of the day, tennis elbow is an ailment which is quite common, which will actually become better in many cases with conservative therapy, and when all that fails, you should opt for surgery. Thank you very much. I've been Amir Ron MD. I'm a hand surgeon. Thank you, and have a great day.